the program?
So I can say where I come from is an informal settlement. That is, if you all know Madare, it's a slum. It's like I can say it's a less fortunate area. So within this area, you find many people don't know or don't have the information on NCD. So within this community, there's drugs, there's every sort of things. And as we all know, this if you don't have information, it can maybe affect you. So
cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll.
Greetings and welcome to another episode on the African NCD Champions podcast. In this mini-series, we are featuring young people who have been working under the Young Health Program in Plan International. Young people who are implementing projects in the communities with the aim of improving knowledge, access to literacy, diagnostics, and influencing policy in the non-communicable diseases space and the sexual reproductive health space, courtesy of the Young Health Program, a program implemented by Plan International in collaboration with AstraZeneca. Today, we have once again meeting one of the peer educators from the community, and he'll be talking to us about his experiences as a peer educator, some of the impact that the program has had in the community, and in part two, we'll talk a little bit more about the stories and experiences that happened during his period as a peer educator implementing this program for over 5 years. And without further ado, give us an introduction to yourself, your name, what you do, and how we got to be here today.
Thanks again for welcoming me to this talk. So my names are Helmut Omondi, but my friends call me Mswati for the good reason, not bad. As you all know, the Mswati from South Africa, but I'm not the kind of that person. So me, I'm a peer educator from Madare, specifically Batini Mashimoni. I do peer education, that is through the program Young Health Program, which is done through Plan International. So through this peer educational, through this program of Young Health Program, we engage the community in the perspective of NCD, that is non-communicable diseases, and at least creating awareness and sensitizing them on the well-being or their health and how they can abstain or put themselves away from the NCD, or how they can avoid the non-communicable diseases. So through this program, we engage the youth, the community, because the program aims or target 10 to 24 years. That's within the community. So that's where the program mainly focus on the age group between 10 to 24 years. So that's why, if you can see, I'm still a youth. So through this, to me, I can say through me as a youth, the age bracket 20-24 is the majority in the community. So if you can see, maybe me engaging with them, because I'm in the right age bracket to at least engage with them. So that's the thing that I normally do within the community through the Young Health Program, and it's a good thing.
Yeah. So talk to us a little bit more about the actual work that you do. You're a peer educator. You are in charge of Mabatini Mashimoni, which is one of the villages in Madare. And you're working in the community, educating people. So talk to us a bit about the village itself, how many schools you manage, and some of the activities that you usually would do as part of the program.
So I can say where I come from is an informal settlement. That is, if you all know Madare, it's a slum. It's like I can say it's a less fortunate area. So within this area, you find many people don't know or don't have the information on NCD. So within this community, there's drugs, there's every sort of things. And as we all know, this if you don't have information, it can maybe affect you. So through this, that's the thing we are doing. So through plan came and at least gave us training on how to more about these NCDs. So if you find us educators, we have at least content, or we have the information on NCD. So this thing, the plan came and trained us. So we especially me with the community. We normally sensitize people, children. We do sessions, weekly sessions, monthly sessions with the youths, the children. So these sessions we normally do them in school. So as for me, I have one school which I'm as for now I'm doing it. So this school, we engage the schools. We take the school with 3 months training with a certain group. Then after that they graduate. Then we take another one. But in the community, we have at least monthly sessions of at least we target at least 40, 30, 32 participants. So then we take them about the modules. The plan of design a module. So we take them at least 4 modules per the monthly the month. Within the month we take them 4 modules. So this period at least we create awareness and sensitize, and then we teach them how to avoid this NCD and what they can do apart from their normal life. So we try to engage them in these activities, in these sessions. Maybe if they can embrace the change. Yeah.
Good. So nice to hear about the work that you're doing, especially with the schools being training cohorts for every 3 months, and the community taking them every month 4 modules until they learn more about non-communicable diseases, how to prevent them, and what to do about it. So the next question I was about to ask you is, what are some of the impact or success stories that you've had as part of this work in the community?
So I can say plan came to within Madare way back, say up to now it's like 5 years. Now when they came, we didn't have maybe as for now things like doing cleanup, eating good foods. So as for now I can say the groups that have engaged in my sessions or modules have embraced a norm that every month they are doing certain things like community cleanup. That's part of our module on air pollution. So you see there, the time they are doing the cleanup, they are cleaning the environment. That's weekly. They are sorting the food, the type of food they are eating. Within this time, they are doing the cleanup. That's the time they are telling maybe people this, you must wash your hands, things like that. So I find within the community, we have embraced that every month we do clean up. So I can say nowadays our community is clean, and even also our children. Nowadays you can find children, the lower class children. Now they are telling their parents that they must eat at least fruits. So you tell you, because we are doing the sessions within the community and the school. So you find the people, the children within the community, majority of them now embrace of eating fruits. Yeah, even then if you come to school, the school that I started with, they embrace the norm of at least giving children fruits, balanced diet within lunchtime. You can see maybe mango, orange, or even banana at lunchtime. And then the change of diet of food. For example, Monday they were eating githeri, Tuesday they will be eating chele, rice. So like that. So you can see maybe the impact of the program within the school and the community through that way. And even also the drug abuse, because our modules is designed like first module is alcohol use, tobacco use. So the rate have decreased in a way that you find nowadays they don't smoke like
they used to before.
Yeah, same way. So I can see the impact within my community, and that's a good thing. Yeah.
Yeah. So my last question is around your advice. Actually, what did you advise other young people in the community, especially on their health, and also on being involved in programs like the Young Health program where they can make a change in the community? What will you advise them?
So me, to my fellow young people, I can tell them, your body is your body, is not my body. So the time that I give you maybe advice, at least take it serious, because it's your body, not my body. So that time that I tell you something, don't take don't spoil your body this time that you are young. They are doing things that people are doing because you want to do because people are doing. Don't do that. Make your informed decision yourself. Your decision matters a lot, not some other decision. Because the reason that I'm saying that like that, the way where I come from, peer pressure is
It's
more.
a big deal.
It's a big deal. So you find more people engaging in bad behaviors because of their friends. So to me, I can tell people, make your own decision. Let nobody do for you the decision. You are the one making decisions for yourself. Don't engage in bad behaviors like doing alcohol, drugs, and sorts of things like that. Yeah. So to young people out there, at least make your own decision. Let nobody make for you decision. Yeah.
Thank you very much again for joining us and for those final remarks on encouraging young people to make their decisions, and especially make informed decisions, because you already teach them, you give them advice, you give them the mentorship. So it's up to them now to make the right decisions to ensure that they continue to stay healthy for the long term. And with that, for everyone who's watching, thank you very much for joining us today, and I will see you on the next one.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.